This conference will now be recorded.
Hello, hola, and welcome. Welcome to the August monthly partnership meeting of SCDRP, the Southeast and Caribbean Disaster Resilience Partnership. My name is Heather McCarthy, and I have the pleasure of serving as the Executive Director of SCDRP. I am joining today from my floating home along the St. Johns River in Northeast Florida. And where are you joining us from today? Please type your name, affiliation, and location into the chat box. Thank you to those of you that already have. And we are such a heterogeneous group, and every month it is such an honor to share this hour with you. A warm hello and welcome. So here is the agenda for the SCDRP August monthly partnership meeting. First, important announcements regarding the SCDRP 2024 annual meeting. And today we will be hearing a presentation entitled Applying Disaster Risk Reduction at the Local Level for Vulnerable Communities with today's super speakers from the Arnold School of Public Health at the University of South Carolina and the South Carolina Department of Health and Environmental Control. After our speakers, we will look ahead at upcoming opportunities for you, including helping us design a meaningful and productive 2024 annual meeting by joining our steering committee, collaborating with SCDRP to help the next generation of resilience professionals through NOAA's Climate Ready Workforce Initiative. And also, folks, please keep your eyes open for additional budding initiatives from SCDRP, including like mentorship and internship programs. And then lastly, we will round out today with partner sharing. So please be ready to share your announcements and resources. First, I am so excited to announce the SCDRP 2024 annual meeting dates have been set. I look forward to seeing all of you at the DeSoto Savannah Hotel on Tuesday, January 23rd through Wednesday, January 24th, 2024. So please keep in mind there will be pre and post meeting events and field trips on Monday, January 22nd and Thursday, January 25th. So please mark your calendars now. And more on this after our special presentation today. And now it is my absolute pleasure to introduce to you today's super speakers, Dr. Dan Kilpatrick and Keisha Long. Dr. Daniel Kilpatrick has a variety of academic and practice experience in public health and emergency management. Currently, Dan is a clinical faculty member at the Arnold School of Public Health at the University of South Carolina. He has experience teaching public health and disaster-related courses at the graduate, undergraduate, and community levels. And this includes leading community managed disaster risk reduction or CMDRR trainings for barangay members in the Philippines, as well as a CMDRR Train the Trainer workshop for international non-governmental personnel with the International Institute of Rural Reconstruction. Dan is currently leading efforts to develop and implement CMDRR trainings for environmental justice communities in South Carolina through a statewide initiative titled EJ Strong, a cooperative agreement with the EPA. Dan has taught a variety of courses in emergency management, including disasters, catastrophes, and their management, violence and terrorism issues, emergency management seminar, and infectious diseases for the healthcare workforce. He has served in disaster response and recovery capacities, including working with the Army Corps of Engineers Blue Roof Project in response to Hurricane Katrina in 2005. He has also served as senior associate with Pierce Global Partners, a disaster preparedness and recovery firm. And through this role, Dan supported the recoveries of major disasters such as the Christchurch earthquake in New Zealand, the Great Tohoku earthquake, tsunami, and associated Fukushima nuclear meltdown in Japan, and the 2011 Joplin, Missouri tornado. His role in the Japan tsunami recovery supported the generation of over $52 million raised from domestic partners for recovery efforts. Additionally, Dan has served as a consultant with Metabiota, an infectious disease capacity building firm, to carry out an assessment of the needs and assets in Southeast Asia and their pandemic risk for the Defense Threat Reduction Agency of the U.S. Department of Defense. Dan was also involved with a global pandemic reinsurance modeling project for Munich Re, a global provider of reinsurance, primary insurance, and insurance-related risk solutions. Dan was appointed as the Emergency Operations Center Manager by the South Carolina State Health Department to assist with the planning of the state's COVID-19 testing, contact tracing, and vaccine efforts. Currently, Dan is serving as the project lead for the development of a graduate certificate and a minor in emergency preparedness and response for the Arnold School of Public Health at USC. So today, Dan will be tag teaming his presentation with super speaker Keisha Long. Wave, Keisha. So Keisha Long is the Environmental Justice Coordinator for the South Carolina Department of Health and Environmental Control, or DHEC. She is an advocate for vulnerable communities and is responsible for helping environmental justice communities build capacity, identify resources, and establish collaborative partnerships. Keisha has been with the South Carolina Department of Health and Environmental Control for over 25 years. Previously, Keisha worked as the DHEC project manager in the Superfund program and the Resource Conservation and Recovery Act program. Keisha is a co-team leader for the ethylene oxide emissions team and is a former co-chair on the advisory board of the Interstate Technology Regulatory Council. Keisha holds a Bachelor of Science in Civil Engineering from Clemson University and is an active Toastmaster. So Keisha will be jumping in to specifically talk about the E.J. Strong initiative in South Carolina. And heads up, Keisha has to zip to another meeting at exactly 10:30 this morning. So we will pause at 10:25 for any audience questions for Keisha specifically. And then Dan will continue his presentation and answer additional questions at the end. So it is my pleasure to present Dan Kilpatrick and Keisha Long.
Well, thank you, Heather. Can everyone see my screen? You see the slides okay? Very good. All right. Well, it's a pleasure to be with y'all this morning in the SCDRP community. And gee, Heather, I should have sent in a much shorter bio. That was humbling to hear. Thank you for reading it and sharing with everyone. And so we really want to share this morning about what we've done over the past 3 years in South Carolina. And we believe it's had a significant impact, and we think it's pretty timely and pretty salient. And again, we've seen some real neat impacts from this work. And so today's talk is titled Applying Disaster Risk Reduction at the Local Level in South Carolina. And if y'all would indulge me a little bit and put in the chat a yes or a no, whether or not you are familiar with disaster risk reduction, also known as DRR, that would be helpful to give me a lay of the land. So if you could just real quick, put in the chat whether or not you're familiar with DRR, yes or no. And while you're doing that, I'm going to set a little bit of a background before Keisha shares about E.J. Strong. And this slide comes from the textbook Introduction to Emergency Management by Bullock, Haddow, and Coppola. Probably one of the most seminal textbooks in emergency management today. It was the textbook that I first used in my emergency management program in grad school. And at the end of the book, the authors share 5 future challenges and opportunities for the emergency management community in the United States. And one of those 5 is partnerships and cultural outreach. And they state it as both a challenge and an opportunity. And I think we all are familiar with the challenges of working with communities at the local level, the cultural and historical and political challenges that we've seen from time immemorial. But the authors state that the great opportunity here for us to do emergency management and involve everyone at the local level. They've seen that emergency management systems work best as a partnership between all relevant stakeholders. This gets to the heart of what Craig Fugate did as FEMA administrator under the Obama administration with his whole community approach. We need to involve business community for business continuity, but more importantly, or just as important, we need CBOs, we need community-based organizations and neighborhood groups to be involved. And what we're seeing with the new resilience efforts, especially with the advent of climate change, and as it's impacting especially the United States, as well as the Caribbean, that we have to start diversifying our risk accountability. And it's not just the federal government or the state government or even the local government that's responsible for our disaster risk. It is all of us, and it begins at the community level. And additionally, there must be this third bullet, an increase in understanding of the inherent value and capacity of any community and any neighborhood group. And this is really where we see the work with community managed or community based disaster risk reduction hitting squarely with allowing community engagement work to do emergency management. And so I like to see that there's this change in posture of responsibility for who does emergency management. And that's why I've included this quote here from Viktor Frankl, his book, Man's Search for Meaning. Frankl being a protege under Sigmund Freud, was a Jewish man in Nazi Germany in the 1940s and was put into Auschwitz concentration camp and developed a lot of his theories for psychopathology through his experience in that concentration camp, and wrote this book, Man's Search for Meaning, after his experience there, and shared this quote when he talks about how freedom, as he's assessing the free world, especially in the western part of our globe, that it's only half the story. We need responsibility. And he suggests that we need a statue of responsibility on the West Coast, just as we have a statue of liberty on the East Coast of the United States. And I think that's very true, especially when it comes to our disaster risk, that we all are responsible just as much as we are free. Okay, so next thing I want to share from this textbook, Introduction to Emergency Management, the authors also share at the end of their book that we have 2 scenarios for the United States moving forward. And I would also say this is probably true for the rest of the world, that as we continue with a potentially status quo approach and just keep doing the same things we've been doing with disaster response and recovery and preparedness and mitigation and the overall emergency management system, if we continue to be reactive, then eventually we are going to diminish our emergency management capacity. We're going to further spread our emergency managers thin or thinner and thinner. And then harder to manage smaller disasters will take place. The hazard events that we have today become the disasters of tomorrow. And what will happen is our disaster relief fund won't be able to keep up. And when that happens, we will see a bankrupting of our country. Does anyone remember how much the COVID Relief Act or the American Rescue Plan costed 1.9 trillion, I think. Can we keep spending that amount of money on these events? So that's the first scenario. We could go to the left side of the road or the right side of the road. And the fourth that we're seeing is that we can avoid this status quo approach and revitalize our emergency management system by getting all key local partners on board. We can enlarge our circle who is involved in the emergency management process. And by doing this, we increase capacity, and then the disasters of yesterday become more easily managed locally. And this is true for climate change related disasters, as well as technological related disasters, which is why I included that picture of the oil refinery on our title slide, because what disaster risk reduction does is it adheres to an all hazards approach, very similar to how FEMA started under the Carter administration. But this is going to require a change in public, private, and nonprofit sector perceptions of needs and challenges. So disaster risk reduction is important. I know I need to toss it over to Keisha here. She needs to go. We are focused on this side of the disaster cycle of mitigation and preparedness. So without any further ado, Keisha, I'll toss it over to you.
Thank you, Dan. And can everyone hear me? Yes, perfect. So I'll start at the beginning because the position I'm in as environmental justice coordinator, and this is starting my 5th year in this position. As Heather stated in my introduction, I started out as a project manager in Superfund. And my background is actually engineering and not community engagement or social science or any of that. But as part of my duties as environmental justice coordinator, I helped to convene a group called the EJ Hub, and it's a collection group, collaborative partnerships with environmental justice leaders who've been working in this space for many decades in some cases. And at the time, there was a lot of concern about a particular company in Richland County, which is where the city of Columbia sits. And they were having a lot of bad press about their processes. And yes, they do work with nuclear energy and uranium. And if you Google it, you can figure out which company I'm talking about, but I won't state their name out loud. So they were in the paper every other week about this and that and the other, and the community was like, what's going on? They were wondering if something happens, will we get a warning? Are there any alarms? What are the emergency response actions? If something does happen, are you going to rebuild or how are you going to remediate? So at the time, there were definitely poor communications between the company and the community and government. So basically what was happening at the time, the company and government emergency managers specifically were saying, we got this, no problem, don't worry about it. And the community is like, that's not good enough. So at the time, the EPA had a RFP on the street. At the time, it was called the State Environmental Justice Cooperative Agreement. They've renamed it to the Government to Government Grant. And DHEC applied for this grant. And we were fortunate enough to receive it. And it's called EJ Strong. And we are, as Stan has stated, working on strengthening communities for disaster risk reduction. And I definitely want to call out Karen Sprayberry, who was the senior advisor for our director of environmental affairs. This is a She started the draft for the grant. She started the language, and she also reached out to Dan Kilpatrick, who has vast experience with CMDRR, to make that connection for this particular grant. So we have several different partners. Our primary nonprofit is LAMPC, this is Low Country Alliance for Model Communities, and they are based in North Charleston. USC, Arnold School of Public Health, the College of Charleston, as well as Clemson University. And for those of you, I don't know if you know that USC and Clemson are bitter rivals. So to have us working together on a very important project, it's a big thing. It's a big deal. So what are the components of EJ Strong? We envisioned having 4 different workshops to discuss CMDRR, definitions, doing vulnerability assessments, hazard assessments, capacity assessments. What can the community um, prioritize in terms of hazards, because there's so many different things that could happen in a particular community. Actually, yesterday I was in Charleston and was told that someone did a master's thesis on if there was a hurricane and an earthquake at the same time in Charleston, then the entire medical district in Charleston would liquefy. And I was like, okay, that's good news, right? So the basic premise to me for EJ Strong is for the community just really to start thinking about these hazards before they hit communities, to build the ark before it starts raining, is what I've said in the past. So DHEC, LAMPC, USC, College of Charleston has a climate group, and Dr. Paul Sanderford is the executive director and a very key member of our group. He brings us back to earth when we're in the clouds. And so he makes sure we're very realistic about what we can or should do. And then Clemson University, they were the lead on our food access map. And the premise behind the food access map, if you remember going back to the beginning of the COVID pandemic, at least in South Carolina, when we had the emergency order to shut down, a lot of the grocery stores closed, restaurants were no-go, and people were being laid off. Clemson University is in the upstate of South Carolina, and they recognized pretty immediately that people were having a hard time accessing food. So they created a food access map that listed different food pantries, nonprofits that will deliver food to your home, or they have pickup points where you can drive by and get groceries. You can have a hot meal, farmers markets, etc., etc. Karen Sprayberry, again, she saw this map and asked them to join our team to expand it to the entire state of South Carolina. And that's what they did. So we have over 900 different locations now and a food access map. So in addition to the CMDRR modules that we've gone through with our participants, we also have a food access map. And no, there aren't supposed to be any different slides. I did not create slides. I just saw that chat pop up. What else can I say? Well, we initially planned to have in-person workshops, but COVID messed that up. So we have had hybrid events, and that has been helpful not only for increasing participation outside the Charleston, South Carolina area, but also we have had participation from Georgia Tech students as well as professors, people in Baltimore, people in Virginia. When we first put in this proposal, we did not anticipate it to really go beyond South Carolina. So we had our last workshop in July, and right now we're actually working on web modules so that we could share it with the world, and that was part of the original proposal also. All right. That's all I have.
Fantastic. Thank you, Keisha. We know you have to run to your next meeting.
I
Keisha,
can
before
hang
you leave,
around for a few more minutes. Yes, yes.
okay. And also, if you would put your email, if you're willing to, into the chat box so that if folks want to connect with you or have questions for you later, they can send you an email.
Yes, yes, I'll do that.
Do we have one question for Keisha before she runs away? Let's see. Okay,
And
that's okay.
I will, if I may, I know I mentioned the food access map, so I will put that in the chat too,
Oh,
because
fantastic.
I love to share this resource. It's been almost transformational tool for our state. So um, I'll add that to the chat.
Fantastic. Oops. Fantastic. Thank you so much for making time for us today, Keisha. We know you have to run, and I will turn the floor back over to Dan. Thank you again.
Thanks,
Thank you for
Keisha.
having me. Yes.
Thanks, Heather. Yeah, so here's our logo for EJ Strong, and a subtitle for us that I've adopted is we're really focused on preventing the next ninth ward scenario, right? When we know there are systemic issues around us, but we have capacity available at the community level that we can organize. Keisha mentioned the rivalry between Clemson and University of South Carolina. And to me, when we strengthen our relationships, that's when we can really build capacity and reduce our disaster risks. So let me move on. This is what the community managed disaster risk reduction framework and curriculum looks like from a process standpoint. This is how we are engaging communities to do disaster risk reduction. And this is fairly novel from a domestic perspective. We don't do a ton of this with classic emergency management. But what this has been so impactful with in South Carolina, especially the communities that we're working with, is it's building this bottom-up realization of the hazards around us and identifying our vulnerabilities and capacity gaps and providing a way for us to really build capacity and address those at the community level. So we all get on the same page in Module 1. We do those four workshops that Keisha mentioned. The first one was about all the concepts and principles and practices related to disaster risk reduction. What is a hazard? What is a disaster? What do we mean by capacity versus vulnerability? And we create a shared language and vocabulary together. And then in Module 2, we start to roll up our sleeves and do the work at the community level, where we're going into our communities, and I'll share some pictures here shortly, and we're doing our assessments. We do 3 assessments: hazard assessment, vulnerability assessment, and capacity assessment. And all of those roll into an overall analysis called the PDRA. If you see that as the first of the 4 minimums of CMDR, those 3 assessments create an analysis framework for us to assess disaster risk. And we do that hazard specific. And once we do a field practicum where we've done these assessments in the community together, and the community is generating their own data, they then formulate their action plan, as we call it, or their DRR measures. And so we come up with a vision and a set of goals and SMART objectives. that are measurable and time bound, and respective activities to accomplish those objectives. And this sort of community engagement and development of this organizational approach at the community level for the purposes of any sort of disaster or hazard event that the community is concerned about really is providing this grassroots effort to move the ball forward, especially to help with those emergency management processes that I tried to provide a background on when we were first sharing. That's not the end of it, though. We are implementing those action plans, connecting with resources, identifying potential grants for communities, and then evaluation takes place, and there's a sustainability component to doing all of this work in a cyclical fashion. So that's the disaster risk reduction approach that we're taking to be managed at the community level with EJ Strong. And this to me is perhaps the biggest framework shift that we see really unlocking this community engagement approach that we've taken. Because classically in the West, we've seen vulnerability in the same way as what is defined as capacities here with this risk equation. Capacity is often subsumed in our definition of vulnerability, especially in the United States. And let me say that again. Capacity is typically subsumed in our definition of vulnerability in the United States. And what we do with DRR is we separate those two. We make them distinct. We define vulnerability very, very narrowly. And I want to be emphatic about that because this is where we see community transformation really being unlocked. When we define vulnerability only as location by time and place, spatiality and temporality, and we make capacity distinct from vulnerability, we are allowed to be more precise in our disaster risk assessments. And furthermore, by not calling a community vulnerable because it might be low wealth or it might have low education percentages, according to the American Community Survey, for example, we are reframing capacities in a positive light that can be increased. And so we are no longer treating our communities from this sort of impoverished perspective because they have low capacity and terming them vulnerability and conflating our vulnerability understanding and our precision. So what we've seen this sort of risk equation really doing in a fairly simple fashion is unlocking the potential for flourishing communities to be more resilient to any sort of hazard event. So let me give a quick illustration. If we talk about the Ninth Ward, as I mentioned in the previous slide. So if I were to ask the question, was the Ninth Ward during Hurricane Katrina vulnerable because they were a low wealth community? The answer with our framework is no. They were not vulnerable because they were low wealth. They were vulnerable because they sat at the intersection of the Lake Pontchartrain Canal and the Mississippi River and the levees that surrounded 75% of the community because of where they were when they were during a Category 3/4 hurricane. They had lower capacity, however, because of that low wealth sort of stigma. And so that's where we can say capacity has to do with those areas that allow us to better respond and recover and remain resilient in the face of any hazard event. And hopefully, if our capacity is high enough, we can keep hazards and from becoming disasters. And this is a quick illustration that we use with some of our curriculum. You can see this is the Western approach on the left-hand side for vulnerability. We are vulnerable by condition. You can see the poor home here underwater and the rich home here a little bit higher. And you would say the poor home is highly vulnerable and the rich home has low vulnerability. And that's really not what we do with CMDR. We look at it here with the panel on the right. You can see the two homes, both rich and poor, connected to one another. And they are both highly vulnerable because of where they are and when they are. Their richness or poorness has to do with their capacity. And furthermore, that's why we work with environmental justice communities in South Carolina, because those very communities are the ones that are usually more vulnerable because of location, because of where they are and when they are. They have a nuclear power plant in their backyard or an oil refinery, or they're at the intersection of the neck of Charleston, where the proposed Army Corps of Engineers seawall is going to end. And they are usually disproportionately burdened by hazards around them because of where they are and when they are, and they have lower capacity. So we really need to be working, especially our emergency management community, with our neighborhoods that are disproportionately burdened by their vulnerability because of where and when they are, and have lower capacity to adequately respond and recover. So these are some photos from our workshop at our community center that we usually frequent to do all of our workshops. And Keisha mentioned COVID forced us to do these with a hybrid approach, and that really unlocked our reach for who could participate. And even though it was more challenging and forced us to innovate a bit, especially doing participatory activities together, how do you engage a virtual audience to do that? We had some neat ways that we figured some things out to make that happen. So in addition to those workshops, that kind of module one approach to the framework I shared, we also did field practicums where we did those assessments. We walked through our communities. We engaged with things like EJ Screen tool from the EPA to do our vulnerability assessments, and to inform our capacity assessments as well. So we got digital a little bit, but we also had our clipboards and our papers and pencils out as well. And that's one of the premises of CMDRR with empowerment, is that the community members themselves aren't letting the scientists or the practitioners come in and do the assessments. The practitioner comes in and passes the baton, passes the pen and paper to the community member, and that's a real transfer of power, which is all a part of the initial approach to community transformation, and that's the engagement that we take. These are some examples of the hazard assessment that we do. Is on the left-hand side. You can see it's specific for flooding. Then we do a vulnerability assessment after that. That's the middle panel here. And again, they are specific to whatever hazard we're focused on. And then a quick excerpt from our capacity assessment is the third panel there on the right. And that's what we're doing. Here's some screenshots of the EJ Screen tool that we use to inform our capacity assessments. We have wildfire risk for our Lower Richland community that participated in our field practicum. You can see 80 to 98 percentile for wildfire risk. This is an area that, if you look over here on the bottom right, also heavily has flood risks, where the Wateree and Congaree rivers come together, and the Congaree National Park is just outside of Columbia. And so similar sort of issues we see with something like the Maui wildfires last week or the week prior, that wildfire risks abound, and we may not always consider that those are probable problems for us. Here's some examples of the objectives that we've developed during our action planning meetings, identifying emergency shelters, a resilience hub for our Lower Richland community. They've identified some emergency response system needs that they would like. Heather, that fits squarely with what our UN representatives shared at the annual meeting, that every community in the world will have an early warning system by the end of next year. We see very similar needs happening here domestically, even though that's being reported from United Nations perspective. So this is the sort of work we're doing now with our communities after we've participated in these action plans, that we are connecting with resources and we are implementing these activities. So some successes we've seen, as I've mentioned, we work with environmental justice communities. And the very definition of environmental justice is that such communities have not had a voice in the decision-making process for which hazards they are most proximate to. And so by giving communities the data, giving them evidence to bring to city planning meetings, county council meetings, they can share their risks with their decision makers. And what we've seen in Lower Richland, for example, is a $300,000 allocation from South Carolina's legislature towards our early warning system efforts. Similarly, one of our communities in Charleston, the Rosemount community, took their field practicum data to the city, and the city allocated $100,000 for their resilience plan just for the Rosemount neighborhood. So enabling communities to have this data and give them a voice, come to these meetings not with emotion, but with evidence and data for decision making, is unlocking some potential here. Involving our students has been excellent. This is even a part of some succession planning with our community champions. Some of our very students are from these communities, and they have interest in doing this work and seeing it through. And there's some additional accountability there and ownership, which we found really refreshing from the academic perspective. We have one flood researcher out of Charleston who works with children, and she takes our DRR equation and she teaches this to children to learn math. For example, when you divide by a higher denominator, if you have more capacity, what does that do to your risk? It's going to lower your risk. So when you can increase capacity to address flooding, you can understand mathematically that you can lower your disaster risk. So Dr. Mary Kester out of Charleston is doing some of this flood tutoring with secondary school students to teach flood resilience in addition to learning some math behind the scenes. We've also seen networking just happen organically as we are pulling these communities together. They are identifying shared needs, but also shared resources that they can tap into, additional grants that they can apply to. One of our workshops, we had our EPA project officer to come and share about the latest collaborative problem-solving grants coming out of EPA, the government-to-government grant coming out of EPA that have been largely focused on doing disaster preparedness and response community engagement work, especially in EPA Region 4. I already mentioned the hybrid workshop approach. Really what we've learned is that this international model, the Sendai framework for disaster risk reduction is international, right? We don't often see these things tracking domestically, but this effort with CMDR has been highly relevant to do that kind of traditional challenging community engagement work. We've spent extensive time to build community trust. This didn't happen overnight. Keisha mentioned the Low Country Alliance for Model Communities. Our university and DHEC has had a relationship with LAMC for over a decade. And we have a lot of partners and a lot of individuals that have long-standing relationships. And that sort of connection really requires or to do this work really requires those connections and that sort of liaising with communities, and CBOs and neighborhood groups enable that to happen. The hybrid training modalities supported a lot of engagement. What we saw with our kind of participatory tools that we were doing trainings on and sharing that energy in the room and our virtual participants seeing that take place. We had one community member participating virtually from Lower Richland, and our training was in Charleston, and he saw what was happening on Friday and the excitement that was happening in the room, and he drove down to make sure he could be there in person on Saturday. But needless to say, when you do that hybrid approach and the sort of participatory trainings that we do with CMDRR that can translate, with the energy in the room to even virtual participants. But it does take a lot of coordination, and it takes good facilitation, and especially good technological prowess with a good audio visual information or IT guy to assist, or gal. Hybrid approach required by the pandemic really encircled or broadened our circle. So some of the products we came up with, I know I'm being long-winded, Heather, chime in if I need to cut it here, but these are some of the products. I mentioned that resilience plan funding that was provided by Charleston. A number of our Lower Richland participants went through community emergency response training carried out by Richland County Emergency Management. Our Georgia Tech student partners developed an app. So rather than doing those paper and pencil based assessments that I showed pictures about, we now have an app to do that. That's available for download on Android. iOS is a little bit more challenging, and that's in development now. Keisha mentioned our food security map. And really what we saw, or what we've seen with the latest round of funding, especially coming out of EPA under the infrastructure stimulus, is that a lot of grants are focused on doing CMDRR related work. And we would like to think that the successes of EJ Strong have shown that this can be done around the Southeast and nationally especially. So in conclusion, EJ Strong and CMDRR provide a framework, a methodology, a curriculum for how to do community engagement for the purposes of emergency management, for the purposes of reducing disaster risk. And this approach that we have, could be issues related to something like the Flint lead water crisis. It could be, as Keisha mentioned, something related to the chemical industry in your backyard, or a nuclear power plant, or it could be sea level rise. It could be a pandemic. This is an all hazards approach, and it's really focused on the preparedness and mitigation phases of the disaster cycle. It's customizable. Our Lower Richland community is a large geographic area. Our Rosemount community is much smaller than that, but CMDRR is relevant for any of these communities. So with that, I'll conclude and toss it back to you, Heather.
Fantastic. Thank you so much, Dan. I think we want to do maybe just one question. And Dan, if you would, if you're open to it, please type your email address into the chat box so that as folks think of questions, they can shoot you an email afterwards. I have about 5 minutes to update the partnership on some news. One question for Dan. See? Okay. So much that you covered
Right.
today. Vamsi, you have one question?
Yep. Uh, so, Dan, thank you so much. That was a fantastic talk. So, my question, I actually put it in the chat box, but I'll ask it that disconnecting
Okay.
vulnerability and capacity is a great idea. Uh, I'm guessing that it also likely builds confidence in the communities that they know that they already have some capacity that maybe they didn't know before. So, can you give an example of how this sort of thinking empowers communities? Is there any sort of positive feedback loop? Have you seen evidence, like quantitative evidence, for that kind of happening as opposed to the conventional approach? And do you have any standard toolkits that potentially other people can use in their own settings?
Yes, thank you, Vamsi. Great question. Um, the CMDRR curriculum that we use is heavily focused on what we call participatory learning and action tools, or participatory rural appraisal tools, PLA or PRA. And these really come out of the Peace Corps realm of how you do kind of community development, relief and development across the globe. And so they, drawing a hazard map just using pen and paper to do that. Doing pairwise ranking. Let's see, what are some of our other PLA tools? Storytelling. Um, so those are very sort of basic tools that have high impacts. And those are some of the trainings, the toolkit that we give to our community champions. They become equipped to do those PLA tools and to engage their communities with those type of tools. And they are, we give them which assessment would storytelling be really helpful for? Which assessment would pairwise ranking be really helpful for? Additionally to that, we use EJ Screen. That's not proprietary. That's very helpful, fairly user friendly. And so I like your mention on not having these proprietary tools to inform such hazard assessments, needs assessments. I think that's the name of the game because we are in the business of empowering communities.
Fantastic. Thank you, Vamsi, and thank you, Dan. And I think, and so much to what you speak of today, Dan, the all hazards approach, the community making decisions for themselves approach, just reemphasizes over and over again the importance of partnerships and collaborations. And that's why all of us are here today. Thank you, Dan. I have two main topics to discuss with you and before partner sharing. So first, do you have an interest in helping formulate the content and composition of our annual meeting? We need at least 3 more members to join our 2024 annual meeting steering committee. So if you are a current SCDRP member with dues up to date, you are eligible to join this committee. It's a short-term ad hoc committee. The time commitment is discrete, 1 hour virtual meetings every 2 weeks from September to January. And we need at least 18 steering committee members from all different professional sectors from across our region to help develop content, invite speakers and panelists, organize field trips, invite sponsors and donations to enable us to offer student and nonprofit scholarships, a social reception, honorariums, and invitational travel to invite resilience rock star speakers to inspire and challenge us. So, in order to make sure that all perspectives and geographies are represented on our steering committee, we extend a special invitation to those of you from Spanish-speaking communities, organizations representing historically marginalized communities, Caribbean territories and nations, and Florida. Yes, we currently do not have anyone on our steering committee from Florida or the Caribbean. So we would love to have you join us. Please let us know if you would like to join by emailing us at scdrp@socorro.org. And one more item, looking ahead, SCDRP is strategically planning how to serve our region by helping to develop the next generation of resilience and recovery professionals. SCDRP is exploring if and how best to respond to NOAA's Climate Ready Workforce for Coastal and Great Lakes States, Tribes, and Territories initiative. We are interested in organizing a skills needed for climate resiliency in my state roundtable discussions with employers in Florida, Georgia, South Carolina, North Carolina, and the Caribbean territories. I kind of envision these as virtual 60 to 90-minute roundtable discussions during the month of September. During these roundtables, we would like to hear from employers on what the rising workforce needs, how might SCDRP be positioned to assist with insufficiencies in skills and or needed training programs. So does this interest you too? Would you like to participate in a skills needed for climate resiliency in my state roundtable? Would you like to work with me to organize these roundtables and invite participants from your state? I currently need a state lead from Florida and one from South Carolina. So please email us at scdrp@socorro.org and let us know of your interest. And I look forward to hearing from you. For those of you, we love to do partner sharing at the end. We're a little tight on time. If you would, before you leave, please type into the chat box any announcements that you might have. And and we will share them in our next newsletter. Also, at any time, please email us at scdrp@socorro.org and provide us with any additional resources that you would like to share with the group. So this concludes our August monthly partnership meeting. As we approach the peak of hurricane season between now and our next meeting, please take care, stay safe, and a heartfelt thank you for all that you do to protect and ready our communities. A very special thank you to our super speakers, Dr. Dan Kilpatrick and Keisha Long, and thank you for joining us today. We look forward to seeing you all again on September 28th. Have a wonderful day.